right, dude. So guess what? I just got a half sleeve. You guys want to see? You have to wait a little bit.
Can you have tattoos? In the physical therapy workplace or in physical therapy school? Now, let me tell you a quick story. When I was in DPT school, probably one of the most stressful times of my life, that's when I got this. You're just studying so hard, you're grinding through the books, you're going through the classes day in, day out, wake up, study, sleep, wake up, study, over and over. I just needed something a little different, something shocking, something that might give me some pain, something to bring me back to reality that I am still a normal human being. And tattoos are something that I've wanted for a very long time. And I just didn't have the time, or really was contemplating, should I get one, should I not? Is it going to hinder me from getting a job? Is it going to take me away from building rapport from patients? If this is something that you're thinking as well, in this video, I'm gonna be answering those questions. But if it is something that you're wondering, give this video a like, because we're gonna get into that. Lego. Hey, what's up you guys? My name is Dr. Liftforchange, physical therapist, or you can call me Justin Lee. Here in this channel, you'll find videos on fitness, physical therapy, and lifestyle that helps inspire self-change. I help students get into DPT school, set them up for success in physical therapy school, coach them through getting through academics, coach them through helping their finances, and setting them up for success after DPT school is done. So if any of that interests you, I do have that service, so just feel free to email me and we'll get in touch. So, tattoos. What is that like? Like I mentioned earlier, I got tattoos when I was in DPT school. And you know what? I'm going to show you a recording of when I got it, because it was painful and I was studying while I was doing it. I was getting it done and I was like going through the slides, like, oh, it's so hard to study because I was getting pained so bad. And I'm telling you, there was this part like right here, right on the bone. It like radiated all across my chest and onto my side, my obliques, and oh, whew, it hurt really bad. I kind of want another one.
Mid-session break. Here's what we got. Excuse the blood. Freaking fantastic job. I'm gonna tag him below, so definitely go check him out if you're around the Alhambra area. This guy is at his name is Kurt from Ink Slingers. Show it some love and you'll see what it's all about. Oh man, dude, this tattoo is sick.
Yes, you saw that correctly. Studying and getting a tattoo at the same time. Taco wants a tattoo as well. But you know what? You just gotta grind as a student. You gotta do what you gotta do. If you guys are all about that grind, Put it in the comments. I'm all about the freaking grind, baby. So, what's my take on tattoos in the physical therapy workplace? So, I think tattoos are a thing that is becoming way more and more common. And of course, it kind of depends on where you live. Depending on the state, depending on the county, depending on the region, right? If you're in a more liberal place like California or Seattle or New York, I think having a tattoo wouldn't really be a big deal. But if you're in more conservative places, it might be a good idea to consider if you should get a tattoo, and two, if you should put it in a place that's super visible. So whenever you're working and you think about the attire that you're wearing, right? So as physical therapists, you're generally wearing a short sleeve shirt. When I'm working, I'm wearing a polo and it stops about right here. So you can see this part of my tattoo and on, and of course you can see the lettering as well. But like I mentioned, it depends on where you work. So right now, I work in Hawaii. And those of you who don't know, Hawaiians have hella, or if you want to use the Hawaiian language, they have choke tattoos. Choke means a lot. So it actually is a form of building rapport, because when a patient walks in and I see that they have a full sleeve or they have tattoos, I go, hey, I like your tattoos. And then they'll look at me and be like, hey, I like your tattoo. And while we're talking and while I'm treating them, tattoos are a point of conversation almost every single time that I have a patient. So to me, it actually relates with the patient in this area of Hawaii. But if I was maybe working at a hospital or a different setting, it might be a different story. So it really depends on where you're working, the location, what setting you're working at, right? So if you're working at an outpatient ortho clinic, it might be more accepted to have tattoos. And typically at outpatient clinics, tattoos they're typically okay. But if you're working, let's say, in a hospital, right, then that's something that you should consider, and maybe you should really consider wearing a sleeve. When I worked in the hospital or when I did my rotations, I had to wear a sleeve. And what I did when I first met my supervisor was to ask him, hey, can I show my tattoos? And I showed him what it looked like, or should I wear a sleeve? And they said that, yeah, you should probably wear a sleeve because in the hospital, it's just company policy and blah, 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 blah. So that's fine. So then I invested in a dry fit kind of material, and I just had to wear it during the day, and then as soon as I was done with work, I took it off. Super simple. So if you're ever wondering, like, can I show my tattoos or not? I would always err on being more conservative and then taking your supervisor in a private room or something and showing them like, hey, can I show my No, I'm just kidding. Hey, can I show my tattoos? And if they say yeah, then that's no problem at all. So my next point when it comes to tattoos in the workplace, and if you're thinking about getting a tattoo, I would try to really consider if you can put it in places where you can maybe cover it up, right? So if it's a sleeve, then that's fine. But if you're getting like, a lip, kiss right here, or if you're getting skulls or stuff like that, then that might be something that you might reconsider, because that might delay you or be an obstacle for potential jobs in the future. And lastly, while I was in physical therapy school and I had tattoos, professors didn't care at all, right? In PT school, you're taking your shirt off, like everyone's shirtless. There's so many people with tattoos anyway, and none of the professors care. And I went to a conservative Christian university, or a Christian university that has the DPT program, and they didn't really mind it at all. So if anyone is offended by it, just be courteous, ask, right? It's always better to ask rather than to just do it and then offend somebody. And that goes along with being in school or being in the workplace. If you guys like this video on tattoos in the physical therapy workplace, I'd appreciate it if you give this video a like. And if you have a friend who has tattoos and is considering being a physical therapist, please feel free to share this video with them. And lastly, if you have any questions regarding tattoos, physical therapy in the workplace, potential jobs, or just your personal situation regarding tattoos, let me know in the comments and I'll get right back to you. Thank you guys for watching. I hope this video helped inspire you to maybe get a tattoo now, right? Get it in some places that you might have wanted to, or maybe not. We'll see. Let me know. I want to hear your story and your situation in the comments. Thanks guys. Thanks for watching. Stay lifting. Stay aloha. Have a great one, you guys.